Temporomandibular dysfunction is a very broad term, and it can probably be best regarded as two types of conditions. And there's one type of condition which the problem lies within the muscles around the joint, and the other type where the problem is within the joint itself. Now, the first type is really a muscular problem, and that usually results from pain within the muscles, and those are the temporalis and masseter muscles. And patients often have a tension type headache on the side of their face, and they might describe that their head feels like it's in a vice. It's often worse in the morning. They might have a sort of foggy head feeling, and sometimes they'll have a feeling that their hearing is affected, and sometimes have additional noises in their ear. And that's often related to various types of so-called parafunctional activity, which leads to tension and spasm and pain within those muscles. They're often enlarged, they hurt when you press them, and that type of condition can usually be managed quite conservatively. The key is to find out why the muscles are tense, and if it's related to tooth clenching and grinding, which is by far the most common cause, then the management of it often involves liaising with the patient's dentist, and they'll usually start by making a type of splint. That can protect the teeth being damaged, but for some people, some types of splints can also reduce the amount of clenching and grinding. The other thing, of course, is awareness. For some people, when they become aware that they're clenching, for example, during the day when they're working on a computer, they can, by being aware of it, try and reduce that amount of clenching, and that can help a lot. Now, patients who don't benefit from those sort of very, very conservative means can benefit from injection of Botox into the muscles, and that works by preventing the transmission of nervous impulses to the muscle. So essentially blocks the nerve from telling the muscle to contract. And the injection is fairly straightforward. It's relatively painless. It's a very low risk procedure, and it causes the muscle to shrink and become less tense. And that gives patients a relatively long relief, sometimes 3 months, occasionally longer, and if it's repeated, it tends to last longer. But that can be very helpful for patients who are in especially a short-term stressful situation where they're clenching and grinding their teeth a lot because they're going through a very stressful time of their life that's going to last a long time.